Welcome to CNBC Africa panel special. As always, my name is Arnold Kwizera, coming to you from Rwanda's capital, Kigali. Now, if you want to be part of any of these conversations, tweet us at CNBC Africa. You could tag me directly at The Real Kwizera. Now, today's conversation is about building robust health systems, and we have a panel of experts to break that down for us. But before we get into who our panelists are today, let me give you a little bit of context. Well, if anything, the need for more robust health systems on the continent has been exposed by the COVID-19 pandemic, more so in the second and third waves. Some countries are experiencing fourth and fifth waves. So what could be the practical solution to this? Some people say vaccines. Some people say setting up those factories and manufacturing centers for those vaccines. Now, to introduce our panel of experts to break down this for us, I will start with Professor Salim Abdul Karim. He is the professor of global health at Columbia University. We're also joined by Dr. Ebere Okereke. She is the Senior Public Health Advisor at the African Center for Disease Control, or also known as CDC, who have been at the helm of this fight against COVID-19 and advising most of the African governments on how to tackle the pandemic. So it's only right to start with Dr. Ebere. Thank you for making the time, Doctor. Doctor, the way the pandemic has shaped health systems, what has it exposed about our health systems?
First of all, thank you for having me. It's a pleasure to be here. What has the pandemic exposed about the health systems? I think that the lessons are not just for Africa, it's global. It has actually shown how central health and health infrastructure is to the whole functioning of society. And the COVID pandemic has effectively ground every other aspect of this functioning of society to a halt. And it's made it very clear, I believe, to all governments that you can't have economic growth, you can't have development, you can't have education if you haven't first considered a robust and resilient health system. The pandemic has shown us that even countries that have invested significantly in the health system have a lot to learn and had weaknesses in the system that were exposed by the pandemic. And the pandemic has also built on and exacerbated existing inequalities in health across the globe and within society as well. So what does it mean for us in Africa? It means that we need to stop thinking about health as a nice to have and think about it as a central and essential aspect of our ambitions for development and economic growth. The health system cannot be secondary anymore. We have got to put it front and center. And when we're thinking about the health system in this case, it's not just about the curative system, it's not just about hospitals, it's about preventative health, it's about infrastructure for pandemic preparedness and response. So it's actually really the key message is health has got to be front and center in any countries, any governments, any society's development agenda.
Very detailed there. And I want to start from that point of where you say it's no longer secondary. And I want to bring the Professor Karim, into this conversation. And Professor, I want to give you a little bit of context, right? In 2001, African countries under the AU met in Abuja, and they made that AU pledge, that Abuja declaration, where they committed at least 15% of their annual budget to improve the health sector. Now, this came to be known, as the Abuja Health Declaration. Now, fast forward 10 years later, 2011, only 2 countries had met that target, right? That was South Africa and Rwanda. 10 years to 2011, 2021, right? Only 20 countries have even tried to increase their health budgets. Some have even gone ahead to cut their health budgets. Now, is this a wake-up call?
Well, a very good day to you and all of the viewers. At the heart of what we're dealing with in the COVID pandemic is that we are seeing the importance of each of the different components of our healthcare system, whether it's in surveillance and the way in which we collect our data and report it, the way in which we institute our prevention programs in the community, and the way in which we provide healthcare in our facilities and across the board, all of those things need to be adequately resourced. And the commitment to get to a funding level that would meet the requirements to provide that kind of healthcare service is critical. Without the political commitment that would make that target, I don't believe that we would be able to achieve the goals that would be necessary to deal with this pandemic and with future ones to come.
Well, bring you back into the conversation, Dr. Ebere, quickly, how could we pick those lessons and then boost things like manufacturing of vaccines on the continent?
Well, first of all, there is a need for a global reckoning. There's the conversations led by the United Nations and WHO to reflect globally about how we learn the lessons for the pandemic. As you know, reports have been published around the lessons learned and preparing. There is saying that making this the last pandemic. I don't think that it is ever going to be the last pandemic. The interface between humanity and its environment means that there will be more, but we're hoping that we'll be better prepared. Coming down to Africa, we have been talking about for some time now, it predates the COVID pandemic, about a new public health order for Africa. And that's about us taking responsibility for our own public health systems. It's about developing a robust health systems that are resilient, that are based on the best evidence, building the workforce and retaining them, because that's a critical issue, and looking at manufacturing some of our own health needs, vaccination being one critical one that is relevant to today's conversation. So we need to nurture our own health systems. We need to design systems that are appropriate for our own context, for our own resources. We need to actually make sure that, as I said before, health is central to any government's development agenda, and that includes making not just about the financing, but ensuring that there is a continuous political commitment to the investment in health, because it's a marathon, not a sprint. So we need to move away from a little bit of funding going into health to actually thinking long term, thinking about 20, 40-year strategies to build up our capacity. So a case in point is around vaccine manufacturing. And as we've all heard in the news all the time that since the COVID vaccines became available, Africa has only managed to vaccinate less than 2% of its population, while other parts of the world are beginning to think about booster doses for their populations. And this is a critical issue. This is an inequality that the whole world will suffer the consequences of. But in Africa, we do have a responsibility to address that. Currently, we only have capacity for vaccine manufacturing for 1% of our needs. So the Africa Center for Disease Control is leading a partnership for Africa vaccine manufacturing, working across the EU member states to actually put the systems in place to change that narrative. We need to build our own manufacturing capacity, not necessarily because we're looking for pure self-sufficiency, because no part of the world can ever be totally self-sufficient. But if you don't have any manufacturing capacity at all, then you're not in the room, never mind at the table when discussions are being made about vaccine distribution. So we have got to build that capacity and then start to challenge and ensure that we actually have access to existing vaccines and new vaccines in a way that ensures that our populations are served equitably.
And I want to stay with you there, Dr. Ebere. It's one thing, to manufacture the vaccines. South Africa has been manufacturing the vaccines, but most of these vaccines have been leaving the continent, and going out to Europe and Asia. And yet the vaccines that are being manufactured in Europe are staying in Europe. There has been some form of nationalism. Now, what can African countries do to ensure that even with these partnerships, that they start putting their people first?
This is the manufacturing that has been happening on the continent and being exported abroad is because of the arrangements and the contracts that were made. We didn't own the facilities that were being developed. We didn't own the technology. We didn't own the intellectual property. We didn't own any of the mechanisms for that manufacturing. We've got to change that. That does require us to work collaboratively across the continent. We need to look at creating our own market that is attractive for vaccine manufacturing. And actually, we're not looking to emphasize that we're not looking for handouts. We're looking for an investment that will yield profit for the companies in question. That does require us to work together as a continent. We have 1.4 billion, a population of 1.4 billion. We have a vaccine a need that is going to continue to grow because we have a very young population and our fertility rates remain quite high. So there is a market there. But there are also barriers, which is what the Partnership for Africa Vaccine Manufacturing is trying to collaboratively work together to address, to say, what are the things we need to put in place to ensure that there is an effective, accessible, and attractive market for vaccines manufactured in Africa that can be accessed by the African market. That does require us to have some conversations with the companies that own some of the intellectual property for new and existing vaccines to talk about how do we share access, to the technology. But also important for the long term is that we need to develop our own and expand our own research and development capacity. We have capacity on the continent. We need to grow it. We need to give it room to actually help to answer some of the questions about the diseases that we need vaccines for on this continent. We need to stop relying on other people asking the questions for us and actually enable our scientists to ask the questions for our needs and to answer them. That does require a collaboration between government, between scientists, and between private sector investors that we actually build up our own sustainable market.
Very passionate from you, Doctor. Professor Karim, bring you back into the conversation. How do we overcome some of these barriers, and what are some of the major barriers that are stopping us from taking those next steps? Could it be in R&D? What do we need to do to ensure that proper funding goes to things like research and development on the continent?
At the heart of vaccine development is the need to have the three essential components. The first is the human capacity, the scientists, the technicians, and so on, the materials, the raw materials, and you need the facilities. And all three of those come together with the intellectual property that's involved in making vaccines, the know-how in how to make vaccines. So when you take all of those elements in vaccine manufacture, we need to have the investors and the governments that will build the facilities and set up in place the ability to acquire all of the raw materials. But for me, one of the biggest challenges lies in having the human capital, in having the scientists and having the technicians and the investigators to undertake all of the research that's required. What we have seen is that within the COVID pandemic, speed was of the essence. So those countries that had already available research infrastructure, research capabilities, they were able to contribute. For example, 4 of the big vaccines that are being used across the world were tested in South Africa, including the Pfizer vaccine, the Johnson & Johnson vaccines. So the ability to do that kind of research is not created overnight. It is not created because you wish it to be or wave a wand. It comes about because you make a sustained long-term effort. It comes from building on your education systems, building your university systems, building your biotech industry. All of that across the value chain requires sustained development and requires a level of policy clarity that will ensure that you have that kind of capability to do all of the research required. So you make your own IP. Or when you are able to acquire it, you are able to translate that IP into actual vaccine products.
And Professor, just staying with you, what kind of investments do we need to ensure that we make vaccine production on the continent a priority, not only for the people on the continent, but to also boost the capacity of the health sector?
So I think among the investments we need is we need to create the opportunity for African scientists to undertake their research in Africa. We need to create the opportunity in our universities, in the laboratories, for them to be able to do the research. So we don't have to deal with the brain drain that we're seeing. But with that has to come the opportunity for scientists to also partner with others. In the world of science, we don't have a situation where you can just quietly work in your own laboratory and that's the end of the story. Science doesn't work like that anymore. Science is an international collaboration. It's an opportunity to share ideas and to bounce it off others. And if you take the international conference that is going to be hosted looking at the new public health order in Africa, and that conference is being organized by Africans in Africa, is an opportunity for scientists to showcase what they bring to the table. It's an opportunity for scientists in Africa to work together with scientists in Africa. In other words, for us to build partnerships within the continent and from the continent within the international community. I think those are the investments that would enable African scientists to provide the kinds of leadership that will be required for Africa to manufacture its own vaccines.
Very good points there, Professor. Doctor, bring you back into the conversation. The professor talks about collaboration. You hinted on it earlier. Yeah, but what kind of collaboration do we need? Where do we start from? Is it CPHIA as one of the platforms where we could enable, African scientists work more closely together?
Absolutely. The Conference for Public Health in Africa aims to do just that. It's actually to shine a light on the expertise that we have on the continent and to enable the creation of these networks and partnerships that will make sure that we actually punch above our weight. One of the, it's ironic, but one of the good things that has come out of the COVID pandemic and the response is a recognition that we actually have more capacity than we give ourselves credit for. We have seen African scientists, health professionals, politicians innovate in the way that they've responded to the pandemic. So the conference provides an opportunity for us to harness that momentum, that innovation, that recognition of the capacity we have and encourage it to be more sustainable and to create a platform for future growth. We don't have enough. We recognize we don't have enough in terms of manpower, in terms of resources, but we're not actually optimizing what we do have. So the conference will enable us to actually start those conversations. Who is invested in, who is working in various areas where we need to develop and strengthen our capacity? How can we work together across a continent and ensure that the partnerships, the usual phrase, South-South partnerships. We need to look at partnerships between Africans, like the professor said, to enhance what we have here and not just rely on investment from the global north. We have some capacity here. Let's optimize it and then build from there. But it isn't just about what the scientists and the researchers can do. Through the Africa Union, Africa CDC has managed all through the response to this pandemic to get political consensus on the response. We've got to build on that. It shouldn't be a once in a lifetime response to an unusual pandemic. We need, as Africans, 55 member states of the AU to take mutual and shared political decisions around our health, because health doesn't respect, or diseases don't respect borders. So this is, again, part of that new public health order about thinking cross-border, across the continent, For example, we are setting up the African Medicines Agency, which is a regulatory body that will increase the capacity to actually produce and approve our own medicines, not just vaccines, but vaccines being a significant one. By getting political adoption of that agency, we're more likely to create an environment that will encourage innovation and investment and development. So those are the sorts of initiatives that we need to continue to promote and encourage. But we also need to recognize that, like the professor said, it's not going to happen overnight. It takes time. So we need to be in it for the long term.
And Professor, just staying with you there, you've been very adamant in saying, this is not the last pandemic. Other experts have said the same as well. So what kind of innovations do we need to put in place to ensure that we are ready for the next one?
When we look at what the innovation needs are in any pandemic, it cuts across the spectrum from looking at, how do we undertake surveillance? Well, to undertake surveillance, we need to have the diagnostic tools. We need to be able to diagnose somebody by having the tests available. We saw back in April and May last year, Africa couldn't secure diagnostic tests because they were in such high demand across the world that we were at the back of the queue. And it required the Africa CDC to establish a purchasing platform that enabled African countries to pool their requirements to be able to make that purchase. Well, we should be doing exactly that, but creating a local demand, creating a demand for local companies in Africa to establish the capability to manufacture the diagnostic kits. Now, the diagnostic kits are not difficult. It's not rocket science. This is pretty straightforward technology. We have the scientists to do that in Africa. So what we've got to do is we've got to be able to create the market forces that would enable the scientists and the entrepreneurs to come together to manufacture and to innovate in making diagnostics. I've used diagnostics as just one example, but it cuts across, whether it's in diagnostics, whether it's in vaccines, or whether it's in therapeutics. And if you just take now the whole area of therapeutics and the importance of neutralizing antibodies, as we are now seeing it becoming widely available in the developed world, we don't see the availability of those neutralizing antibodies available in Africa because we are not doing that innovation here. So I think across the spectrum, whether we're talking about diagnostics, treatments, and vaccines, those innovations need to start on the ground here. And they will do so because we create the demand for them.
Doctor, I'll bring you into that conversation. That question that I've asked the professor regarding the kind of innovations to curb future pandemics. What kind of innovations are needed, and how do you create that environment for those innovations?
In addition to what the professor described, we have gene sequencing, for an example, has expanded as a consequence of the COVID pandemic response. And we are actually building and expanding that capacity on our continent here. Now, it has the potential, not just in response to COVID, but to actually enable us to improve our response to some of the old diseases that we've been grappling with and continue to grapple with, like malaria, like TB. So we need to invest in that technological capacity to actually use that to improve the age-old surveillance systems and response systems that we use to respond to diseases. We need to invest in preparedness. And that means the people, the workforce, the systems, and the enabling environment in terms of legislation and collaboration, so that when a solution is identified in one part of the continent, it's accessible to the entire part of the continent. So when there's a challenge identified in one part of the continent as a whole is able to respond. Africa CDC, through its coordinating responsibilities and its mandate through the AU, has already begun to do that prior to COVID, in terms of setting up pools of emergency responders who can go to anywhere in the continent to support outbreaks to diseases. We need to take that approach to the whole spectrum of disease health and disease response. Where we have expertise, we need to leverage that expertise to support the continent. And unfortunately, we often don't know what we have. So there is the conference, again, will enable us to actually shine a light on what we do have and encourage collaboration between the small, the small team working in Nigeria, the small team working in Senegal, the small team working in South Africa. Pulling them together is a big team working across the continent. So that's a sort of innovation. Doesn't necessarily have to be new technology. It might be a new way of using the technology and the systems that we already have. So it's all of those things. But I think a critical thing that we must address for us in the continent is that the political mandate has got to be there to enable these partnerships to flourish.
I would just, reinforce what was a critical point that Dr. Okereke made, which is when you take across the world the reporting and the gene sequencing that's being done to identify new variants, when you take that the original descriptions and the discovery of the beta variant was done right here, at the Nelson Mandela Medical School in Durban, the research teams here, it's an indication of what can be achieved. It's an indication that when you set up the capacity and you build the capability and the technology and the innovation, that you can be making contributions not only to the continent, but for global good. And I think for me, that is an important additional benefit that these investments will have. Sorry to interrupt.
No worries there, Professor. Unfortunately, we have run out of time for this great conversation. I feel like it has just started today, but hopefully CPHIA helps us to break down this very important conversation further later on. As always, I'm Arnold Kwizera coming to you from Kigali. Today's conversation was building robust health systems, and our panel of experts were Professor Salim Abdul Karim. He's a professor of global health at Columbia University. We also had Dr. Ebere Okereke. She is the senior public health advisor at the Africa Center for Disease Control. Now, if you're interested in this conversation or any others, tweet us at CNBC Africa or tag me directly at The Real Kwizera. Have a great rest of your day.